Introducing Eschenbach House Call, a Telelowvision program that allows a low vision provider to connect with their patients virtually to conduct a vision exam and device assessment. This is made possible through the use of two exclusive kits that are mailed directly to the patient. The first is the iDoctor kit. This is a diagnostic kit that includes a near acuity, distance acuity, and contrast tests, as well as the tools needed to connect with their low vision provider for a virtual exam. The patient will have the convenience of getting this kit delivered directly to their doorstep. Once they receive the iDoctor kit, they will find easy-to-follow instructions inside. The instructions will guide them through the process of setting up the items needed for their virtual appointment. The patient will follow the instructions and remove all of the contents from the case. Each item will be clearly shown in the instruction booklet and labeled so that it is easy to find. The next step is setting up the iPad, which will be used to connect to the virtual appointment. The patient will need to take out the iPad stand, unfold it, and attach the iPad to the stand using the magnetic backing. The patient will then be able to adjust the iPad so that it is at a comfortable position for them to view. After entering a short password, the iPad will be ready to use. The patient will then open the Google Meet web conferencing application by pressing on the green video icon located in the top left corner. They will then be ready to connect to the virtual appointment. On the day of the virtual appointment, the low vision provider will set up a Google Meet appointment online and call the patient to provide them with a meeting code. Once the code is entered, the patient will be able to join the meeting. The low vision provider will be notified that they are online and allow them access into the meeting room. Once they are connected, the patient will see the low vision provider on the screen. The low vision provider will then walk the patient through the steps to perform the different tests. First will be the near acuity test. The patient will use the near acuity card found in the kit and hold the 16-inch string up to their eye or glasses. They will be instructed to begin reading the text starting from the largest print to the smallest. The patient will stop reading when instructed by the low vision provider. The provider will have a copy of this near acuity card and will be able to get their near acuity from this test. For the distance acuity test, the patient's pupillary distance will be needed. This can be measured by holding the enclosed PD ruler up to their eyes and leaning into the camera. By doing this, the provider will be able to estimate their PD. The distance acuity test will be conducted using the IQ vision tester. The PD will need to be set on the IQ by turning the dial on the bottom of the tester. Next, the patient will need to set up the smartphone. Once the phone is turned on, the patient will open the IQ Insight application by pressing the purple Insight icon. This will be used to complete the distance acuity test. Once the Insight application is open, the patient can go to the profile screen and enter their PD. This will further help provide the most accurate distance acuity reading. A short tutorial is available to help the patient understand the type of distance acuity test they will be taking. This will let them practice swiping the smartphone screen in the direction that the letter E is pointing, as they will do in the real test. The patient can then begin the distance acuity test. They will confirm their PD again and check that all settings are correct. Then they will be prompted to connect the phone to the IQ Insight. To do this, they will need to remove the black strap and cap from the vision tester. They will unhook the strap from each side and lay it down on a flat surface in front of them. Then they will remove the cap and set it aside as well. They will need to line up the two lines on the vision tester so that they are inside the two lines on the smartphone screen and connect the two. The adhesive on the vision tester will stick to the phone screen and the strap can be attached around the smartphone to hold it securely in place. Once the smartphone is attached, they will press the Confirm button on the screen and select if they will be taking the test with or without glasses or contacts. The patient will then be instructed to hold the vision tester up to their eyes and follow the instructions on the screen. As demonstrated in the tutorial, they will need to swipe the screen in the direction of the E that is displayed. Once the test is complete, the low vision provider will have access to the results on the IQ website. The last test the patient will take is the contrast test. There will be 4 test filters to try on, each with different colored lenses. The patient will try each color on and let the low vision provider know which one worked best for them. Once the testing is complete, the patient will pack up all of the contents of the kit and ship it back to Eschenbach using the prepaid label. The next kit that will get delivered to the patient is the iProduct kit. This will include an assortment of products that the low vision provider has selected for them to try. Once the patient receives the kit, they will again follow the instructions provided inside and review the kit contents while connected with their low vision provider through a virtual appointment. The provider will explain how to use each device in the kit and will be able to see the patient as they try each one. The patient will be instructed to bring a piece of literature or items they want to test the products on to the meeting. This will help determine which devices work best for them to accomplish their visual goals. A video magnifier will always be included in the kit so that the patient can try the higher magnification levels and color contrast modes that only a video product can provide. The patient will then keep the devices they liked best and ship back the others in the iProduct kit. With Eschenbach House Call, you can get your low vision patients the attention they need and the devices that will help improve their quality of life, all without having to leave their home. Learn more about our Telelowvision program online at www.eschenbach.com/telelowvision program.